As a population, we're proud of our National Health Service. We expect to be able to get from it advice on how to prevent ill health, an accurate diagnosis, and high quality and effective treatment. We also hope to be cared for in an environment that is safe and where staff treat us with dignity and respect. However, we're living in challenging times with a population that are living longer and requiring more healthcare. As a service, the NHS needs to do things differently to do things better. One way forward is to involve patients more in their care when interacting with health services, because at the end of the day, they are responsible for their care most of the time. They know most about how they generally feel, their lifestyle, symptoms, and the things they most value that can affect the decisions they might make about treatment. This approach is quite different from how healthcare has been delivered in the past, which is often described as being paternalistic. The doctor in the white coat is seen as the person with the knowledge and power, and the patient's role is to listen to the doctor and to do what they say. This model of delivering healthcare does not really fit with our modern age, where patients can search the internet to find information about their condition or what treatments are available, and use their mobile phone to monitor their health. So, we're moving into a new era of patient involvement in healthcare. Patients can be involved in delivering a more effective and safer healthcare system in many ways, but one very simple way is to provide feedback on the care that they have received. This feedback can be good or bad. Good feedback means that staff know what they are doing well, and they know to continue to do these things. This kind of feedback is also important for staff morale. Negative feedback helps teams to understand what needs to be improved and to take action to make things better for patients. Over the last 5 years, the Yorkshire Quality and Safety Research Group and the Improvement Academy in Yorkshire have worked with staff and patients at NHS hospitals in Bradford, Leeds, Harrogate and Calderdale and Huddersfield to develop tools for collecting patient feedback on patient safety. Hospital ward teams have also used these tools as part of a new approach to improving care called Patient Reporting and Action for a Safe Environment, or PRASE. PRASE encourages nurses and doctors within hospital ward teams to use this feedback from patients to improve the safety of care for all patients. The tools we used are based on scientific ideas about what factors contribute to patient safety on hospital wards. These factors include the way people in teams communicate with one another and the patient, the way staff are supervised and led, the availability of equipment, and the organisation of tasks. We have found that patients are very able to comment on these things if they're asked the right questions. Patients are also asked to talk about any concerns they might have, or indeed any positive experiences that they might want to tell us about. We have now collected feedback from more than 2,500 patients in Yorkshire and Humber about their care. Most patients are very willing to be involved. Indeed, 86% of those approached were glad to be asked their opinion. The aim of collecting this information is to listen to and value what patients say, and to act on this information to continuously improve. Some have argued that patients are the smoke detectors of our healthcare system. They can spot problems early before things go wrong. If we had listened to the patients and families at Mid-Staff's Hospital, it is possible that lives could have been saved. Patient reporting and action for a safe environment is now being rolled out, and hospital volunteers are collecting this feedback from patients. There are many advantages of using hospital volunteers to collect this feedback. Mainly, they're seen as impartial individuals, allowing patients to provide their opinions without any worry of the consequences. All hospital volunteers are trained to collect feedback from patients, and they're given information about which patients to approach on which wards. Hospital volunteers then enter the ward and undertake standard hand hygiene practice, using the alcohol rub or washing their hands. They're easily recognised by wearing their volunteer lanyard and uniform. This makes it easier for the patient to differentiate them from other members of staff on the ward. Once on the ward, the hospital volunteers ask to see the nurse in charge and introduce themselves as a PRASE volunteer. The hospital volunteers request a list of patients who are well enough to provide feedback about their care. Next, the hospital volunteer approaches the patient and introduces themselves as a PRASE volunteer and explains that they're collecting feedback regarding their experience of patient safety whilst they have been in hospital. The volunteer asks if the patient is happy to take part, and then repositions themselves next to the patient's bed so that both the volunteer and the patient can see the questions which are available on an iPad and work through the questionnaire with the patient. Once the questionnaire has been completed, the hospital volunteer thanks the patient for taking part, and the completed questionnaire is then submitted. The ward is sent a feedback report that brings together all the responses received from patients. And the ward multidisciplinary team, which is likely to include the ward manager, matron, doctors, nurses, healthcare assistants, the ward clerk and domestics, and any allied health professionals that work regularly on the ward, will then meet to go through the report. At this meeting, they will plan how they will do things differently to improve the safety of care they provide to patients.